All right, so we're going to look at the different types of heart blocks here. There are going to be three that we're going to review. And remember that a heart block is some type of defect within that conducting system within the heart. So for some reason, the impulses from the atria and the ventricles are not in sync with one another. There's some type of disruption within that electrical pathway. So let's start off with the first one, which is called first degree heart block. First degree heart block, if we were to look at an ECG, looks something like this. You got your P wave, long interval, Q, R, S, T wave, P wave, long interval, Q, R, S. So this one is characterized by this long PR segment. Okay, which indicates a long AV node delay. Okay. So you can see here, if this is our atrial depolarization and this is our ventricle depolarization, there is now a long segment or interval between them due to some type of disruption within that pathway. So we're seeing an increased delay at the AV node, this increase in the PR segment. So that's first degree heart block. Moving on to second degree heart block then. It's going to look something like this on the ECG readout. You're going to see a couple P waves, that QRS complex, followed by a T wave, couple of P waves, QRS, and that T wave. So you're seeing a couple of P waves or atrial contractions for each ventricular contraction, right? This QRS complex. So basically what we see here is that not all of those atrial impulses are being conducted to the ventricles, right? We're seeing 2 atrial contractions for every ventricular. So this is appropriately called 2-2-1 heart block. That's the type of heart block in the second degree heart block. Now you could also have, if we throw in another P wave within here, this would be then 3-1 heart block. Okay. So that leaves us then with what we call third degree heart block or complete heart block. Now third degree heart block is going to look something like this. So a little more random here, I'm going to couple of those P waves, Q, R, S, couple of T wave and P wave, Q, R, S, T wave, P wave, Q, R, S. Let me label these here, a couple of P waves. Here's a T wave and then a triplet of P waves. Here's a T wave and then a single P wave. This, of course, is our QRS complex. So what you can see with third degree or complete heart block is the conduction from the atria to the ventricles is completely interrupted. So each are doing their own thing independently. So those ventricles are using the bundle of His or the Purkinje fiber nodes and beating at a slower rate, and then your atria are going at that normal 70 beats per minute, let's say. So everything gets out of sync and out of whack, and that's what you would see on that ECG.